and struggle with hair loss, but new treatments and technology can help.
That is true. The team over at Zering Medical is working with the latest microscopic treatments for hair restoration, and joining us to discuss is dermatologist and hair transplant surgeon. There he is, Dr. Craig Zering. Good morning to you. It is Saturday. It is wet outside. We appreciate you being indoors and with us. What are some of the common causes of hair loss?
Good morning. Thank you. Yes, most common cause of hair loss is pattern hair loss or genetic hair loss for men and women. But some other things that can cause problems are autoimmune disorders, there's alopecia areata, and then stress is a big one. Even COVID has caused a lot of hair loss problems for people.
So let's talk about prevention for a second, because is it possible to prevent hair loss?
Well, you can't fight your genetics, which is the major thing, but you can do early intervention with both oral and topical preparations. Minoxidil, finasteride come in both of those forms, as well as laser treatments. And we even have some new regenerative medicine therapies that we use with growth factors and in exosomes to help treat people as well. And then good, care with a healthy diet, green leafy vegetables, things like that are also important.
I can tell you, as a woman with a lot of hair and people always commenting on it, when I was pregnant, and I'm pregnant again, right after breastfeeding, I lost a ton of hair. And it's always that, like, what are some non-surgical treatments out there for people who are dealing with that, whether be pregnant or not, but if you're dealing with hair loss?
Yeah, so postpartum hair loss is very common, and obviously that's a problem. And you want to have good scalp and hair care. So just using good products, shampoos, conditioners, not using anything that will be damaging to the hair, not using really a lot of straighteners and things like that will be really important. And then obviously the medications that we talked about before, some of these regenerative medicine, growth factors, the oral and topical preparations and laser therapy can be very helpful restoring hair.
Okay, so you also perform surgical hair transplants. So what exactly does that entail, and who might be a good candidate for it?
So anyone that has realistic expectations, who's suffering from pattern hair loss in particular, but other types as well, traction alopecia, so hair loss from damaging the hair from tight braiding, people that have had a genetically high forehead and they want to lower their forehead, and patients that have thinning eyebrows, even people with patchy loss in the beards can be really good candidates for hair transplants. You just have to have good donor hair from the back and sides of the head so that we can perform that.
Women, more specifically, have this specific hairline look, if you really think about it, like different than men. How do you tailor surgical treatment for women versus men?
Yeah, it's really important to make that distinction. So women in particular have a rounded hairline. So you want to see there, it's rounded there. You can see a heart shape. And so you want to make sure that you follow the hairline shape, as long as the angle and direction and orientation of those grafts, you get a nice natural look. But women are fantastic candidates, and often people ignore that and just talk about men with hair transplants, but women are great candidates for surgery and can get awesome results.
Every time I go to a stylist, I always say, I need an agreement with you. If you see any signs of balding, please let me know. So my question for you is there a line between what could be just considered, where am I? I'm trying to go with this question. Is there
hair loss or thinning?
Yeah, like a natural receding compared to, like, where do you draw the line between the natural recede and what may be considered a candidate for this?
Yeah, excellent question. And people have trouble with this all the time. First of all, it's normal to have a little bit of shedding. 100, 150 hairs a day can be normal. What the key thing is if you notice any thinning or loss, you should check with a hair loss specialist, because early intervention is the key. And there are often things that we can do prior to surgical intervention, such as the non-surgical options, to really reverse the thinning process. And if it's genetic, if you're receding too much, and that's what a hair loss specialist or dermatologist will be able to identify, there's lots of treatment options there. So you shouldn't suffer with hair loss.
I think suffering is a good word, because a lot of people out there, they have shame attached to it. And it's like, just present the issue, understand that it is an issue, and it's fixable if you're willing to pay for it and that sort of thing. So thank you so much for starting this conversation. I'm sure people at home are going, you know what? Looking in the mirror, going, maybe I should go get this checked out. For more information on hair loss prevention and treatment, visit ZeringMedical.com. Very easy.